These are the circumstances that test us, our leadership, and our partnerships. Your leadership, your med group, is up to this task. General Goldfein says the fight is on. With that said, the 412 Medical Group exists to provide that trusted care anywhere and anytime to support the warfighter and strengthen the community. We place the highest priority on the safety of our patients, staff, while maintaining high quality care in all our facilities. So starting in the upper half, the situation. The coronavirus disease, 2019, COVID-19, is a respiratory illness that can spread from person to person. We are in a national health emergency, and the state of California is under a public health emergency. California has over 400 cases as depicted on the map. As far as Edwards, there are no confirmed cases at this time. On the lower right is a stoplight chart that depicts our status of operations at Edwards, and it can be found on our AF.mil page. This is going to be updated daily, and I will be going into what that means for your med group. The lower left shows the curve of the cases in the United States, which is one of the key reasons we went into HPCon Bravo, due to that increased number in our local vicinity. The CDC says the immediate health risk to the general public in the United States is still low. But as the outbreak expands, that risk increases. And although the slide depicts only the number of cases and deaths, for most people, it produces a mild illness, and there are over 100,000 people who are actually recovering from the coronavirus at this time. Unfortunately, as with the flu, in some cases it can lead to serious illness or even death. So it is still very important to practice those strict social distancing as well as that strict hygiene. Next slide. This slide is to illustrate everything that we do is to reduce exposures to COVID-19 and slow the spread and reduce the impact of the disease to the base, its mission, as well as the impact to your med group and the local hospitals in our community. Now, the reason why it says HPCon Bravo Plus, as you heard me say, we are in a state of national health emergency and public health emergency. So we already have some HPCon Charlie measures in place, such as the strict public gatherings guidelines, as well as those travel restrictions. From a medical perspective, if we were to go into Charlie, it means we have increased number of cases leading to us further reducing our services, and Delta means we have widespread transmission. And at that point, we would only go to emergency services available. Next slide. Now, as you heard me say, the fight is on. This slide will be posted daily on our Facebook Med Group page, and is stating our overall status as well as our current service available. So what is your med group doing for you to protect you? First and foremost, we are screening all patients for symptoms and travel history prior to entering any of our facilities. For those patients with symptoms or travel exposure risk, we will adhere to those CDC guidelines and public health protocols designed to prevent transmission. Also, the staff is performing self-monitoring, strict hygiene protocols, as well as ensuring all exams are disinfected between patients and all commonly used surfaces are disinfected multiple times per day. We are also adhering to the strictest social distancing guidelines. So the biggest takeaway from this slide, for all services, call ahead to be scheduled for an appointment. That includes services such as lab and immunization. Again, this is all to safeguard all of us against COVID-19, and we thank you in advance for your patience and understanding. Now, I would like to pause before I go to the next slide and address our testing capabilities. For those who live and work on Edwards, we have testing available, and it has a 3 to 4 day turnaround. And we are working hard to get in-house processing capability. With that said, the local community also has testing available. What is important to note, for every person screened, regardless of symptoms or not, We are also checking to see if they should be tested. We and our local healthcare community partners take this very seriously. Next slide. All right, so you heard me say over and over again, the fight is on. But we cannot fight alone. We need your help to flatten the curve. The slide goes into depth, but the key takeaways are: wash your hands, cover your cough, practice that strict social distancing, and if you are sick, stay home. More importantly, if you need to be seen, and I can't stress this enough, call ahead. Call ahead if you're having flu-like symptoms. Call ahead if you may have been exposed to COVID-19. Now, before we open it up to questions, I would like to acknowledge we are likely to be all stressed to the limit when we are responding to COVID-19. And now is the time for us to call to mind what makes us resilient and sustains us. So Team Edwards, if you need to talk, we have people who are ready to help. We have 4 undocumented individual sessions, not therapy, that are available, which are focused on emotional stress related to COVID-19. These are available during duty hours through the mental health clinic, AFRC, as well as the chaplaincy. Again, we are here to support you and make sure you always get the right care at the right time here at the center of the aerospace testing universe. Thank you for your time, and now for your questions, and Chief Aishin will actually be joining us.
Okay.
So we've got a few questions for you, ma'am. One of the first ones that's coming up, I'll grab a seat here in just a second. So why is public health still utilizing international travel as a guideline for criteria?
All right, I'm going to turn it over to Captain Langer.
So it kind of depends on who the individual is that we're analyzing. So per the CDC and per the DOD, actually, any active duty member that comes from anywhere overseas is supposed to be tracked by us, which they have been, and they also have to go in an immediate quarantine for 14 days. That's DOD policy. As far as international, it's still good to know because there are still hotspots. So if you came from Italy, that would be a bit more concerning than, say, if you came from someplace that doesn't even have any cases or has minimal cases. So even though there isn't necessarily a strict one-size-fit-all algorithm to do as far as risk assessment, that's what we use the CDC for. And so we use what's happening around the world and we'll apply it based on certain situations. So risk can be different depending on where you're coming from. And then again, in the case of the DOD, if you're an active duty member, that's already, if you're coming home from anywhere overseas, they're the ones that mandated that. And we're going to go into the 14-day quarantine just to be safe.
I've got a very specific question for medical. So should this person take their 9-month-old to a pre-scheduled medical appointment in Palmdale? This person is up to date on their immunizations and we have no medical concerns, or this person doesn't have any medical concerns at the time, and the wife is concerned about non-essential travel. So is this a risk worth taking?
All our local health community partners have set up as far as what their services should look like to keep that risk to a minimal. So first thing I would say is to call Palmdale and see if they're saying that that appointment is essential. If they deem it essential, your risk is very minimal because they are doing all the same screening procedures that we are doing within all their facilities. And when they do that screen, if there's anyone that has symptoms or has a possibility of being exposed, they're not going to be allowed into their facilities. And that's along with AVH as well.
Okay, I have a question for Chief Aishin because it's not directly medically related. What are your plans to help accommodate parents with children? Schools are out and they may not return in April as originally reported. If this happens, many of us will be struggling to find care for our kids so we can work.
No, this is a huge concern. So the biggest problem right now is we have no idea what's going to happen next week or the week after. Everything on this base is day by day, and really everything in the city is day by day. So right now, we have an open CDC and youth center. We plan on that continuing as long as we can do that safely, and we've had questions actually on the CDC itself, so I'll answer that at the same time. For every base is doing it a little bit differently. There's no right answer, but every base is trying to weigh the risk of bringing children together with the mission that has to happen. And by mission, I don't mean testing aircraft in the air. I mean the essential services. Our medical professionals are here right now. Some of them have children. And if those children aren't able to go to a CDC or youth center or a daycare of some sort, they're not able to help us. And so we knock out maybe one of our very few IEMTs or the doctors on this space. At the same time, we have our security forces at the gates. We have our security forces patrolling. We have our fire. We have our medical. We have our EMS. All of those are necessary services no matter what's going on this space. And so there's a constant risk decision that's done daily. How do we keep our children safe? At the same time, making sure the mission happens. The CDC is a much better situation right now, only because most of our children are in very small areas. They do a great job of cleaning. The staff is doing great work, and we can isolate 2-year-olds from 3-year-olds or newborns from 2-year-olds. And so we have a much better chance of doing it as long as we keep things clean. At the same time, we have a lot of parents who are not bringing their children into the CDC, and I completely understand that as a parent. The CDC is not charging those parents. They will not be, doctor pay for those times, and then their spot will be open when all this is over, as long as they're bringing their people out for coronavirus. So I hate to say that's a long way of saying we don't have a good answer for that yet. Day by day, we're trying to weigh those risk decisions. This is what the wing commander is doing and the wing leadership team is doing. And so we will try to keep as many services open as long as it maintains, or as long as it's something that we can do safely. Hopefully that answers.
All right. The next question. Captain Linkard, if you'd like to take this one. If we have confirmed cases of COVID-19 on Edwards, will we be told where and when these people have been on base? I believe this would be a vital step in isolating this thing.
Absolutely. So when it comes down to having confirmed cases of COVID, firstly, we want to be completely transparent with everything that's happening on the base, basically at any given time. So if we were to have a confirmed case, the first step is that my office, medical, would end up alerting the public health department. We'd have to report it to the state, so that would get out there, and we would also be able to release that information. As far as actual contacts of that case, what we would do is we would do a risk assessment. We'd actually start what's called contact tracing. So we'd interview the patient, see where they were going, see whoever they might have had close contact with, and this is close contact as defined by the CDC. So it wouldn't be necessarily were you in the same building as a person. We would have to do it as a case-by-case basis to identify who's at an actual risk for potentially contracting COVID-19. Then from there, we would alert those people and do subsequent interviews with them and let them know, hey, this is what we're advising as far as quarantine steps go, as far as self-monitoring steps go. So those individuals, if you have come in contact with a COVID-19 case, would absolutely be alerted.
So I've got, go ahead, ma'am.
No, because I was could you define close contact?
Yes, ma'am. So close contact is basically a prolonged period of time spent around somebody within 6 feet. So it's not necessarily going to be passing somebody in the hallway, but say you're taking care of a family member at home. Say you were sitting down and eating lunch with somebody at the same table and you're having a great conversation. That would be kind of what close contact is. And again, it's kind of a fluid definition a little bit, so there's a little bit of wiggle room, but that's what my office is basically here for, is we're here to identify risk in conjunction with the docs as well. So we are here absolutely to make sure that everybody's protected and we completely have a good assessment of the situation.
So one thing we're getting is I want to know why the base hasn't cut back on personnel. They're talking that we've got a lot of retired military working on this base. So I'd like to let you know that SecDef just put out guidance today that anybody 65 and older, and again, let me back it up, we've got a lot of different types of people, archetypes, if you will. We've got active duty, we've got active guard and reserve, we've got civilian GS is different from wage grade, our NH and our NKs, we've got unions, we've got our NAF civilians. All of these have different rules, regulations, and guidelines. And so this basic makes it difficult to say things. So when you see a civilian is at home, that civilian can be on admin leave, they could be on sick leave, they could just be teleworking. There's a lot of different scenarios, and so we have to be clear on which unit we're talking about and which category of civilian. For GS civilians, our NHNK, so the Civilian Manpower Office is our headquarters for everything civilian. But I received word, and this is where you need to talk to leadership, but DOD is working on guidance for our civilian airmen that are 65 and older to try to make sure that we keep them out of any type of dangerous situation. And it's going to change based on that. If you are a union employee, you need to talk to your your union. Our contract employees need to talk to their contract lead. And so the answer for most of this is it depends. But I can tell you that wing staff in multiple units are already going to a blue and silver teaming, which means only some of them are at the office right now. The others are at home teleworking, and never the two will meet. Everything will be done through phone calls and emails. So if one group gets sick, we still have that backup capability. We're doing the same thing with parts of our defenders. Our medical is working on this. We have a lot of airmen, again, civilians and military, already at home teleworking if they have that capability, and we're working to get as many as possible. So the answer, it depends, is really what it is. But if you have a very specific one, please hit me up, send me a message directly, and we can look at your unit specifically and see if we can help make that happen.
Speaking of the telework, there was a question for contractors coming into work. Their civilian employees or civilian counterparts are staying home and teleworking. And from what I'm told, there's not a direct answer to that yet. Do you have anything that we can possibly tell personnel?
No, so again, it's going to be case by case. I am
Okay.
not a civilian manpower expert. I'm learning more and more every day. But between the squadron leader, director, whoever it is, and our civilian personnel office, that's going to be the best way to do it. But we're trying to get as many people out the door and at home to keep this, to flatten that curve as quickly as possible. There is this question asking about banning military spouses, or excuse me, banning veteran spouses from accompanying that veteran in the commissary. We have no, that is not a policy on this base. If you are a veteran spouse and you have an ID card with commissary privileges, you are allowed right now. I just left the commissary, that's why I was late to this town hall. And there are veteran spouses in there right now buying bread, buying milk, because we have those things in the commissary. So as long as you have commissary privileges, you are allowed in the commissary. You may be speaking about DECA guidance, so I gotta let everybody know, the wing does not own the commissary. It is a service that resides on this base, but that's owned by DECA. DECA and the military have a great partnership, and they're working really hard to make things better for everyone. But DECA put out guidance in the last 48 hours that said they are not allowing guests or anybody that does not have actual status to enter the commissary. So that is a DECA guideline, and we are following that guideline.
All right, Captain Langford, what precautions should pregnant employees take? Should they be concerned about coming into work?
So pregnant employees actually were recently added to the high risk category, just like the people that are 65 years and older. So we'd recommend them taking specific precautions as well. If you work off base, I know that the governor of California just recommended that pregnant people basically try to restrict going out and maximize telework as much as possible. As far as actual disease prevention, we would recommend, and the CDC also recommends, they take the exact same precautions that everybody else in the nation is taking, with the hand washing, cover your cough, just like Colonel Foster said, all of that. That's everybody across the board, no matter what your level of risk is, that's your way to not get this disease, essentially. But yeah, other than that, the only thing that really centers on pregnant females specifically is going to be the same with the 65 and older precautions, essentially, which is basically minimize your going out and into the community and really get on that social distancing.
All right, we have a pharmacy question. Will the pharmacy provide prescriptions beyond 90-day supplies? And if so, will that happen automatically? Or do we need to prompt the system to extend to the 120-day supply, or will the automated call-in system be adjusted?
Currently, we do have the 90-day supply, and we are seeking guidance as far as pushing it to the 120-day supply or more. So we are working to be able to do that. Major Steering, did we have any other things on pharmacy as far as the supply?
So I think that the goal is to make sure that patients have a bridge of their medication to the middle of June to allow us to have time to get people in after the May 11th guidelines.
We have a few other pharmacy improvements that are happening just to make sure we have that social distancing in our area. One of those is that if the prescription is put in by your provider in our clinic, they are auto-batching those prescriptions. That means you do not have to specifically activate that. It will be automatically filled. One thing that is a big change is there are no same-day refills unless it's an emergency, which you need to contact somebody, get on a phone with, so we can make sure and fill that for you. So basically what we're doing at our single point of entry, if you are just dropping off a prescription, we will take that for you. You won't even have to set foot in the building. And then it will be filled and ready for pickup the next duty day.
So we're getting a question about Space A. Just asking if Space A is still available for retirees. So I can let you know that Edwards Air Force Base does not have any Space A flights. We didn't before this happened. And so that's just not something that we offer because we are not a mobility base. We do not have flights going to and from various military bases for the most part. Most of our things happen within our airspace. So for any specific Space A questions, you would probably need to go to Travis. That's our closest Space A terminal, and March Air Force Base. I do not think that they're doing any Space A because almost all travel has been restricted unless it's some sort of mission essential travel, getting out to any of our deployed units downrange. But the subject matter experts for that are going to be Travis's Facebook page, March's Facebook page. So they have, Space A passenger travel for Travis. Those are the best places to look, and you can get right with their air shop, and they'll be able to answer that question for you.
Okay.
Okay, I've got a question. So it says a lot of the news is saying that carriers have been asymptomatic. Additionally, it's being reported that the virus can survive in the air or on surfaces for several hours. Wouldn't that mean there are risk factors besides close contact?
That's actually an excellent question. So, in regards to that, the CDC has not come out with any sort of determinate answer on that. Right now, all we know is that for sure, if you have the 3 symptoms of cough, fever, shortness of breath, that's the primary transmitters. That's what we're currently concerned about, and that's what's linked to most cases. I know there have been whispers in some studies of people that were asymptomatic spreaders at this time, but for overall, the main spreaders of COVID-19 have these symptoms because they have to have the symptoms to actually get the virus out there. So if you're not coughing, it's not really going anywhere. Because of that, that's why we focus on those individuals, and specifically those individuals with those 3 identifying symptoms.
All right, we have a question. Are there COVID-19 tests available on base? And if so, why are people who are showing symptoms being told they won't be tested unless they've been out of the country?
That's another great question. So we do have tests on base, but just like the rest of the nation right now, those tests are severely limited as far as stock goes. And like I just mentioned, the CDC does have an algorithm. The county is using the same algorithm. Everybody is using the same identifier of you need to have an epidemiological, which means some sort of connection to a case, and then also have symptoms at this point. That's just to maximize testing the people that are actually have the highest likelihood of actually being cases. So then my office of public health entities around the area in the world right now can target what our interventions are from there. So to recap, both because of limited supply right now is why we're not going out there testing everybody. Obviously, if supply was different, that might change. The testing algorithm might broaden a bit. But right now, we are currently following CDC guidance to have. You need to have the epidemiological risk, so you need to have close contact with the case or coming from a place overseas that has a travel advisory that's at a certain level. And then you also have to be exhibiting the symptoms because we're still in cold and flu season at this point. Stuff goes around, and the symptoms of fever and cough are very similar to the common cold. They're very similar to influenza. So this is kind of how we have to do that disease detective part of it to really tailor our interventions and tailor who we're going to see based upon the risk and then the algorithm being put down by the CDC.
All right. Will walk-in pediatric weight checks still be available?
So the answer is that there's going to be no walk-in appointments available in the clinic. So everything should be a call first, and then it will be assessed whether a face-to-face visit is required.
All right. And then what about advice for personnel with autoimmune diseases?
Personnel with autoimmune diseases would fall in that same high-risk category that we mentioned with the pregnant females, with people aged 65 and older. It's the same advice across the board. It's to maximize that social distancing. If you are going out, do the same thing that everybody else in the nation is doing with the hand washing. Just avoid general disease spread. And basically, it's following the exact same steps. There's not really a teased out part for autoimmune. They're all in the same group.
So one question I've got: what will happen with maintenance workers who can't telework? Maintenance is not a job that lends itself to telework, but it all depends on the category. Maintenance is one of those units, depending on where you are in the maintenance crew, where we could have varying levels of government civilians, as well as varying levels of contract workers, union employees, or civilian airmen and active duty airmen. And so the answer to that one is it depends. If you are an active duty airman, everything I've seen, it's going to come from the maintenance group commander, and then all the way down to your squadron leadership. But my recommendation would be to ask them. I know they're working on their teaming strategy. How are they going to let people telework? Which people are they going to bring in, and how do they ensure that they can sustain and maintain this base for the long term? Because again, if we knew this was going to end in a week, we can make decisions very differently. But since we don't know how long this is going to last and we have to prepare for the long term, this is where those blue-silver team is going to come into key, or into a key portion of everything. And so I need you to talk to your maintenance group and maintenance squadron leadership, and then get that guidance from that lead, because they're going to know the details of your specific situation.
Back to a medical question. What is the approval process for a scheduled surgery out of the local area, especially when we know other medical centers may also be canceling appointments as they go through?
So according to the DoD guidance, all medical travel is considered exempt from the restrictions of travel. However, you'd have to call first to the office where you're getting your surgery to make sure that they're still doing procedures, whether they have to push things out or looking at doing urgent procedures now.
We just got another question in. Are there any confirmed cases on base as of today? And I want to reiterate, there are 0 confirmed cases as of today on base.
Correct.
How are children age of 4 affected with past history of pneumonia and RSV, likely in that high-risk category as well, or should be treated as such? Do I understand properly that we should call before picking up called-in prescriptions? I work on base and need to pick up for my mother. Absolutely call ahead, but do understand that the pharmacy experiences a high volume of calls. We're still working to see how we can augment that. Because if they're busy filling prescriptions, they may not be back there answering the phone. We have recently instituted a few things to help with that process, but moral of the story, yes, call ahead to make sure it's ready to be picked up if you don't want to waste the trip.
All right, we have time for a couple or more questions, Chiefs.
So one question I think everybody's going to ask, and maybe you'll say this, ma'am, is when are you doing this again?
It will be weekly, so every Thursday at this time, we will be dialing in to make sure you know what is happening here at your med group and on Edwards.
Let's see. We were getting a high volume of these. I am medically high risk. If I begin to show symptoms, how should I go about receiving treatment?
So if you have any concerns about COVID-19, if you think I have symptoms, any of that, make sure you call the appointment line, and from there the doctors will be able to triage you and they'll be able to interface with all the different offices, and we can give you a good risk assessment, can make sure that you also get the care that you need.
And then just a reminder, any questions that we do not get to face-to-face with this town hall, we will either answer on our website or we'll make that public on our Facebook page.
One more question? Any other questions?
Not right now, ma'am, so we're having some technical difficulties. So the good thing is, I'm going to let you all know right now, we understand that Air Force IT networks are having issues keeping up with not only telework, but the needs that we have right now. And so all of this is great data to help us figure out exactly what we do need and how to make all of this better in the future.
Let's see. We did get a good question. Are civilians able to get tested on base?
Yes.
If they meet the criteria.
Yes.
There you go.
Yes.
Should personnel with previous pneumonia and valley fever be considered high risk?
That I would put to their PCM to kind of look at their medical history, do a self-evaluation. It's kind of hard to do an across-the-board you are high risk if you get these specific conditions, but definitely consult with your PCM. They'd be able to give you a much more tailored and specific to your situation assessment.
And that's why it's very important to call ahead so we can make sure that you are getting the proper treatment. One last question?
No, we're getting a bunch of them. A lot of them are on the same thing.
Okay.
So keep sending your questions, and we will keep answering them. So it's going to take a little while to get the consolidated list. People have asked about closed captioning support. We will have that as well. That's part of any public affairs video. And then we will make sure we hang this. I know it's probably gone in and out as we've been doing this feed. And so we also have it being videotaped live. And so we will make sure that there's a consolidated video that goes out by the end of the day. Man, I appreciate all you guys coming in and then letting me to hang out with your guys' town hall. So our medical professionals are doing a lot. So I can tell you right now, the emails are coming out over and over again. Guidance is changing, and not just from the CDC, but nationally. And so there's a lot of movement. So if you're finding yourself having a hard time actually keeping up to date with everything. So are these guys. And so they're working really hard to make sure they know what to do so they can give you the proper advice. And so I thank you and all of your team for taking care of everybody else and then, making sure that we're good to go.
All right.
Thank you, Chief, and thank you everyone for your time, and until next week. Thank you.